Well, hello everybody. I'm Dr. Saeed Danishman. I'm the practice director of the Fertility Center. And we established our Fertility Center 28 years ago in the state of Nevada, just on the outskirts of Las Vegas. So we have, that's our main center. We have two centers there, one in the city of Henderson. That's where our Genetics Institute is located. And then our IVF lab and our IVF centers there. And then over the years, as our international surrogacy practice has grown, now we see patients from over 35 different countries in the world. Then what we did was we expanded our reach. So now we have a satellite office in Los Angeles. And then this weekend I start seeing patients in our New York City office, which is on 3rd Avenue and right on 91st and 3rd Avenue. So we've been doing surrogacy for a long time. I think it's important for your journey to work with seasoned professionals, professionals who are, and there are a great many of them here. That's why it's such a great day to meet physicians, attorneys, agencies. We work with many agencies in the United States, the ones that are organized, professional, that are really going to hold your hand throughout the whole journey. We have a terrific team. We have a team of almost 60 people. We have wonderful people like Richard Westerby right here, who heads and directs our European operations. Richard is a dad by surrogacy. He has beautiful twins, and he actually wrote a book on surrogacy in the United States. So Richard can guide you, can support you, is always there. And Richard's advice and counsel is of no charge to you. So whether you decide to use us as a fertility center or someone else, that's perfectly fine. You could still use his services. He works with us, and I think that when I met Richard about 2 years ago, I was just so impressed with him and his knowledge about the whole process that I wanted to work with him. So what I want to do today is, because I know you guys have had a lot of lectures today, and it's been a long day, what I would really like to do is just kind of open the floor to questions and specifically answer the questions that you have. And I think that would maybe a better way to go, unless you want me to go over sort of the general outline of how to choose a surrogate, how to choose an egg donor, and those kinds of things. If not, if you have specific questions about this journey that I can answer for you, things like, should I put a single embryo or a double embryo transfer? What's the risk of prematurity, with twins versus singletons? Should I do chromosome testing on the embryo before I transfer the embryo back in? What's the advantage of chromosome testing? Is it going to improve my live birth rate? Is it going to improve my pregnancy rate, the health of the baby? Do you do any genetic screening on me or the egg donor? Those kinds of things. So just some ideas to sort of start the conversation. But I'd love to just kind of find out from all of you in terms of what specific questions you may have that I may be to answer for you. Yes, I think we have a...
I'm curious about how our process would be affected by you having a New York office.
Sure. So what's the reason for our New York City office? Because we see patients from all around the world. I just came back from Oslo and Stockholm. For many of my intended fathers in Oslo and Stockholm, it's a lot easier for them to get to New York than it is to Las Vegas or Los Angeles. So what we do is we see them here. They do, because what do they have to do? When we have international couples coming in, they have to do their FDA screening. The FDA screening is the infectious disease testing that everyone has to go through because the FDA regulates surrogacy in the United States. That's a blood and urine test for things like hepatitis A, hepatitis B, hepatitis C, those kinds of things. And then they have to freeze their sperm. So we do that here in the New York City office. So it's an easy Oslo to New York City, Stockholm to New York City flight versus all the way to the West Coast of the United States. Now, why the LA office? Because we have many intended fathers in Melbourne and Brisbane and Sydney and in Australia and China who want to actually have direct flights over to LA. So we're trying to make the process easier, more convenient, and frankly less costly. And one of the things that we're working on right now is collaborations with other fertility centers. So that, for example, for monitoring if your surrogate is from Illinois, I can reach out to Dr. Belsos in Illinois and say, you know what, Angie, can you see this particular surrogate? And let's have a collaboration together, and I'll see your surrogate if she's in LA. So collaborating, sort of turning competition into collaboration. Because all of us here are busy. We're seasoned professionals. I've been doing this for almost 20 years. And I think that the goal here is to make it less costly, more convenient, and really make the journey beautiful, because this is a journey to parenthood, and I think it should be a wonderful journey. It should be the team that you work with should always be available to you, and we should decrease the level of stress for all of you as much as possible. Yes, there are definitely stressors involved. There's a financial aspect to it. There's decisions on embryo transfers. It's finding a surrogate, finding an egg donor. But I think if you have a great team behind you, you can lessen those stressors, and that's what we are trying to do. So Richard and I have been sort of mapping out a plan for the last year and a half. Is how can we make surrogacy easier, less costly, so that more people can afford it, more people can become parents, through the years. So that's what we've been working on, and we've been diligently at it. And the work is not done. We're just continuing. So that's the reason for the New York City office. And of course, if you live in New York City, very convenient. You just have your sperm frozen here, and because we can't do right now the transfer to a surrogate who lives in New York City, we can freeze your sperm, do the FDA screening, and then ship the sperm to where we're going to do the egg retrieval and embryo creation and do the transfer there to the surrogate. So New York City office. I went to medical school in New York City. I lived here for 4 years. I have good friends here, and it's a great excuse to come back.
Is it possible to do egg retrieval here?
You can do egg retrieval, and we can do egg retrieval, and you can create embryos here. But we, at this particular point, we'd rather still do the transfer, another, because again, compensated surrogacy in the state of New York is not allowed. Okay. Now, is it possible to have a surrogate from Pennsylvania fly out here, do the transfer here, and then have her rest for a day, and then have her go back to Pennsylvania? It's a gray area. I would say most academic centers are not doing that. Most centers are not doing that. Is it possible to do? Yes, but again, we always tend to be on the conservative side of things.
So in line with that, so if we have an egg donor here that we know of,
yes,
and it's our sperm,
yes,
we can give both to you, and then it will be shipped somewhere else.
Yes. So if you have an egg donor in New York City, we can do her screening right here in our New York City office. Mm-hmm. So because remember, with egg donors, we do psychological testing on them. We do genetic screening. We evaluate the quality of the eggs in their ovaries with a blood test and an ultrasound. We do a general physical exam on them. I get an initial assessment of their personality, intelligence level, sort of some initial psychological markers. We can do that right here in the New York City office. And then we have to make a decision. Okay, so you can get your sperm frozen right here. Do we want to create the embryos here and then ship the embryos and do the transfer somewhere else? Or do we want your egg donor just to fly over to us, do the retrieval, and do the embryo transfer and the retrieval at one of the other offices? And that has to do with more like logistics and costs and which embryologist is going to be in which. Because the beauty of this New York City office is the lab was opened up by my embryologist who has been with us for 8 years. So if you look at our pregnancy rates in 2014, 2013, and we have our latest 2014. If you look at one of our brochures, it'll have our pregnancy rates using a surrogate and an egg donor in 2014. The same embryologist that was responsible for those pregnancy rates is right here in New York City. How do we do that? Being in 2 places at one time, because we batch our cycles. So we are doing IVF every 5 weeks. So every 5.5 weeks, we do our IVF cycle. Then my embryologist actually lives in New York City, so she comes over to us for 2.5 weeks to finish the IVF cycle, and she comes back here. She used to work for several fertility centers here doing the same thing, and then she decided, she wanted to open up her own lab, and so we decided, well, you know what, let's have a collaboration and invest together in a New York City office. Yes?
If the first implantation doesn't take, do you
Right.
have an unlimited package? Or
Yeah,
I know
most clinics have unlimited package. In fact,
Okay.
the interesting thing is we started the unlimited sort of embryo transfers about 13 years ago.
Okay.
And we started it actually in our regular IVF. And then it's extended to every IVF cycle that we do. So 13 years ago, the reason we started the unlimited embryo transfers is because we never wanted patients to be under duress to want to transfer more than 1 or 2 embryos to increase the pregnancy rates, because they said, well, if I don't get pregnant now, then I'm going to have to pay you another $4,000 or $5,000 for another transfer. So we said, okay, let's take that financial disincentive out of this, and let's just, if it doesn't work, let's have just transfer 1, maybe 2 if you twist our hand. But if it doesn't work, it's okay, because next month we can get you ready for another transfer. So absolutely, all of our cycles, regular IVF, surrogacy, egg donation, all of our cycles have unlimited frozen embryo transfers. We have something called an unlimited IVF program, which is basically sort of a guarantee to live birth, meaning that let's say you go through all your frozen embryo transfers and you don't have any frozen embryos left, and we don't have a delivery. Then what we'll do is we can get another egg donor, or we have to change surrogates. First, we have to find out why it didn't work. And then if we have to get another egg donor or surrogate, again, there's no further cost. That's called our unlimited IVF program. But I think if you look at our pregnancy rates, that may not be the best, because actually it's $12,000 more than our regular package. But I think you should look at our pregnancy rates and then make a decision after that, because the rate of not succeeding after the first or second transfer is extremely low. Yes?
Do you have thoughts on the whole debate about twins medically, and also, given the possible increased costs associated with twins,
right,
how much do you think one really saves if one saves on twins versus sequential single births?
Right. So if you look at, here's the sort of the financial disincentive for single embryo transfer, and that is that if you get a second journey, you're looking at about an additional cost of about maybe $50,000. Because why? Because if you do it concurrently, or if you do it at another time, you're still going to have the frozen embryos. So let's say we decide we're going to do a single embryo transfer. So we're going to do a single embryo transfer, your surrogate gets pregnant, and then we're going to have 4 or 5, on average, 4 or 5 embryos that we're going to have frozen. Okay. So now in those 4 or 5 embryos that are frozen, you have a decision to make. You can either have another surrogate concurrently or within a few months do another transfer, or you can wait until your child is born and then decide like a year or 2 years later. Whichever way you decide, you still have to pay the surrogate, which is $20,000 to $30,000. You have to still pay the agency, although the agency is lesser fee. Typically, many agencies will give you a lesser fee. And you have to pay the clinic for the diagnostic screening of the surrogate, and you have to pay the attorneys for another legal contract. So if you add all of those things together, it may end up being another $40,000, $50,000. However, if you ask what is the safest, most conservative way to go to limit the risk of preterm labor and delivery and complications during pregnancy, it's a singleton baby, okay? Despite the fact that over 90% of twins do fine, but that 10% sometimes are born early, and by early I mean less than 34 weeks, because if anytime 34 weeks afterwards you have the lungs that are fully developed, and that's when the complications arise, because they have respiratory problems, sometimes they have bleeding in the brain, and sometimes I can have transient problems, but then sometimes I can have long-term problems as well. But that affects 10% or less of twin deliveries. For couples who want to have twins, want to transfer 2 embryos, what we try to do is we try to minimize the risk by making sure that the surrogate is in the best shape possible, having a minimum of at least 2 vaginal deliveries. We look at the weight of the babies that were delivered in order to make sure that the weight was such that the pregnancy, the uterus can carry twins, at least to a certain extent beyond 34 weeks. And then what I also do is in the office, I do something called a uterine length or a trial transfer. We measure the depth of the uterus to make sure that the uterus is deep enough, again, to be able to carry twins with a certain degree of safety. Now, you can do all those things and still get a preterm delivery, but at least all those things, if you're really diligent and vigilant about it, will decrease the risk of preterm labor and delivery, which is the biggest risk that all of us are worried about. Because once my intended parents get past like 33, 34 weeks, I'm like, okay, thank goodness, because now they're past 34 weeks, so if they're born past 34 weeks, we're going to be just fine. It's okay. We had some children just developed, kids just born at 33 weeks just 2 days ago, and if you look at their picture, actually they look great, and they're breathing room air, everything looks fine. But again, there's 10% or less, sometimes you're going to get complications. Surrogates are typically between 24 and 40 years of age, no medical problems. You have to make sure that you review the medical records from the hospital to make sure that they didn't have any, because sometimes surrogates will forget that they had high blood pressure during the latter stages of pregnancy. And you look at the pregnancy, and yes, the blood pressures were high, and sometimes they're sort of induced a little bit earlier because of high blood pressure. So you have to really review the medical records very, very accurately, and in order to make sure you pick up little red flags here and there. We definitely want the body mass index of surrogates to be less than 30 ideally, and really if you push it, maybe less than 32. I mean, you can go up to 32, but again, that's just the risk of diabetes. The higher the body mass index, the higher risk of diabetes. good physical shape, somebody who has a good home environment, whose family is supportive of the surrogacy process. And we get really a kind of a gestalt of how the surrogate is when she comes into the office when we do the diagnostic testing. I have a whole team, a surrogacy team, who sits down with the surrogates at different points. We have consents, we do physical exams, we do we send them to a psychologist, and so we want to get a good feeling after that visit that yes, this is somebody who cares, whose heart is in the right place. Because frankly, if they paid me $25,000, I wouldn't carry pregnant. The thing is that surrogates are really, I think, they're providing a service which I think is really a selfless thing. It's a gift, and yes, we do compensate them. But going through a pregnancy is not easy, and it's sometimes you can have complications. So I really truly think that they're VIPs, and we treat them like that. We have them picked up at the airport with a private car. We bring them to the office because they are helping our intended parents have a family. And oftentimes they have a relationship with our intended parents for a lot of years.